And joining me now from India, Dr. Alok Kulkarni, Senior Consultant Psychiatrist at the Manas Institute of Mental Health. It's good to talk to you, Doctor, because we've heard much about the deaths, the spread of the virus, and if you like, the physical damage the pandemic is causing in India. But you've been dealing with the very real mental health impacts. How much damage is COVID doing to Indians mentally in your experience?
Thanks, Michael, for that question. That's an excellent question. The mental health impact of the ongoing pandemic has been substantial, to say the least. I've been seeing a varied and diverse range of clinical presentations that have come to my attention in the last 1 year. With regard to this, an elegant study was recently published in The Lancet by Harrison et al., wherein they compared the rates of psychiatric and neurological illnesses in patients who had COVID-19 as compared to patients who had influenza or any other respiratory tract infection. And this study found that the rates of psychiatric or neurological illness were significantly higher in the COVID-19 group as compared to the respiratory tract infection or influenza group. In my clinical practice, I've increasingly been seeing cases of anxiety, panic disorder, generalized anxiety disorder, worsening of the course of obsessive compulsive disorder, depression, and psychosis in the last 1 year.
This is very worrying. I mean, who are most impacted? Are you able to say? I presume people with existing issues, but what others? I mean, I imagine doctors and healthcare professionals.
Absolutely. The administrative system has totally collapsed, and the Indian healthcare system is overwhelmed, and that is largely due to the shortage of ventilators, oxygen, and beds. I've had calls from seasoned professionals who have broken down while attending to COVID-19 patients, and it is a very understandable anxiety. And as you have rightly mentioned, people with pre-existing mental illnesses have had to deal with this double whammy of managing their existing illnesses as also dealing with this newfound stressor.
Yeah. Post-traumatic stress is very real, and I imagine that's what they're dealing with. I mean, how severe has the breakdown in the healthcare system been, and what is happening because of that?
Well, if you look at the percentage of GDP that is spent on healthcare, it is just around 1.25%. And if you consider out-of-pocket expenditure, it goes up to 3.5%. Contrast this with the percentage of GDP expenditure of Western countries. US spends around 17.7% and UK spends around 12%. Whilst we are ramping up on our defense sector, it is vitally important that same amount of attention is also directed towards the healthcare sector. Suffice it to say that although the doctors are overwhelmed, they are putting up a brave fight against this virus, but there has been an administrative collapse.
I know that you've talked too about how doctors are being forced to make some terrible decisions, who lives and who dies, quite literally. What needs to be done to support the psychiatric infrastructure in India, not just for doctors, but for the patients that you're seeing as well?
Well, there was a study conducted in 2015-16. It was called the National Mental Health Survey, and it identified a mental health treatment gap of 70 to 92%. That is a huge gap for a country of 1.3 billion. There are less than 9,000 psychiatrists catering to a population of 1.3 billion. So what needs to be done is that the mental health care system needs to really get integrated into the general health care system. And one of the ways of bridging this gap is by involving primary care physicians in delivering mental health care by harnessing remote technologies.
And just finally and quickly, if you will, do you worry that quite apart from the immediate mental effects that there will be for many people lasting emotional and mental damage done by this?
Absolutely. I expect to see a pandemic of mental health problems thanks to the ongoing COVID-19 crisis. In any case, there was a pandemic of mental health problems that was looming large over this country, and COVID-19 has only facilitated that even more.
That is a really worrying aspect of this pandemic. Dr. Alok Kulkarni, appreciate what you're doing for your patients, and thank you for taking the time to talk to us.
Thank you, Michael.